The Equiscope goes in search of any cell that doesn't hold that perfect electrical charge. It then corrects it in milliseconds until it reaches what is known as membrane potential. That's the power of the Electro Equiscope. You know, your immune system is based on your body's ability to hold charge. We have a device that matches perfectly and synergistically with the electrical capacitance of the human body. We treat dogs, cats, horses, children, elderly.
You know, one of the questions people often ask is, what about this condition? What about this problem? What about this disease? And because medicine is so compartmentalized, it's difficult for them to understand that something could be beneficial to all of those things.
I believe the electroceutical energies you get from the Equiscope is that it's synergistically helping the nutraceutical energies, and when you do that, you thrive. When you use a nutraceutical, like let's say magnesium or D-ribose or Q10, you're taking that by mouth. When you use an electroceutical, like the Equiscope, you know, an instrument that you're applying to the body, and it's the frequencies, and the frequencies literally, what I believe, is driving ATP in a preferential direction again, but it's not like taking handfuls of antioxidants. Now you're doing it electrically.
So routinely we treat patients every day with various complaints, from shoulders to knees to elbows to fingers. They get better. We do lymph drainage, we improve the GI tract.
For the patients that we've been treating, they're all very happy. They're all making improvement, and they don't moan and groan about having their dose of narcotics decreased anymore. That's what I wanted. I wanted to have something that I could offer them that would help them manage their pain more effectively and efficiently.
We've had people with retroviruses, people with mono, people with the Lyme disease, and so we've done the bilateral spine, we've done the higher frequencies for the viruses, and they'll get up and say, man, 50% of my pain's gone.
Over the past several months, we have people flying in that I would never fly in before with bone-crushing pain, radiation pain with lung cancer, chemotherapy pain with liver damage, all kinds of other pain. And these people would have passed away.
I've seen people get up and walk on their own. They haven't taken a single step on their own in 6 years, in like 2.5 hours maybe, and they're up trucking around.
The fellow with the radiation damage from the lung cancer, a horrible pain. He had shrunk by 2 or 3 inches in height because of the damage to his spine. That's really severe. He had bone pain in his ribs where they were cracking. In the first 2 days, he had no pain.
Some of the horses we've seen, we've had them keep from being put down. We've worked with horses that were in kidney failure and brought them out. They were not eating and drinking. When we got there, they started eating and drinking while we worked on them for the first time. Horses with severe infections, cuts, scrapes. Everybody knows horses like to get injured. Vets without this equipment said would heal in 3 months minimum, and we've had it in 2.5 to 3 weeks. They were 100% back to normal, and you couldn't even tell there was ever an injury.
A cello player that damaged her head and her neck at 14 years old. She was first chair in a symphony at 14. She was a prodigy. She went down a water slide and kicked her neck back in a horrible water slide that almost broke her neck. She hasn't played the cello since she was 14. She's 37. She spent the last 10 years being a missionary and doing other things because she lost her love. Her love was the cello. She's got a voice like an angel. Guess what? She sent me a text and said, I'm playing the cello. That's what happens with this device.
We want to change the face of medicine as you know it today into a non-drug, non-invasive world. So who can get this device? Everyone.
We have so many colleagues that come to these conferences and they get intimidated because they're not sure how to use it, so they wait to get it because they don't know how to use it. This thing is so incredibly intuitive, and there's no reason to not get it. It's not for a lack of knowledge that this thing will not be used. It's just not understanding how simple it is.
One of the best things that I have always found to love about the Equiscope is the machine itself. When you see the box, people look at it and get intimidated. They think that it's going to be very difficult to learn. They need to have a huge background. You don't. We can actually, private trainings are 2 days, on-location training with a group is 3 days. And at the end of that, people are able to roll off protocols by memory. It's very simple, easy to use, repetition to get started.
And as safe as the developer has always said, you'd have to throw the machine at somebody to hurt them. So it's as safe as it is amazing. And as Dr. Ferrier says, it's a complete medical suite.
When you can find an instrument that is so straightforward as this, you can put it into a patient's hands and they can use it themselves, that's very rare. It is the most practical instrument I've had in my lifetime, and we have probably $200,000 of equipment in our office. And this one is the go-to every time.
We set out to make the purchase. We've been treating our patients ever since, and our patients are ecstatic with the treatment.
I actually, crazy enough, bought the machine without ever seeing one in person.
This is probably maybe the best investment we've ever made.
And so now we're out to show the world that we have a non-drug, non-invasive therapy that works in every walk of medicine, that we're working on insurance billing. We're out to improve healthcare quality, lower healthcare cost, and be the go-to first.
I've never seen anything like it. I've never seen anything be so consistently effective.
Yeah, I highly recommend this product for my practice and practices like mine, where we see patients who have common painful conditions that can be treated by microcurrent therapy that no one really believed before. It's amazing.
I've increased my practice over 35%. It's a no-brainer. It's easy. And everybody's got more patients than they can possibly deal with that has pain. It makes no sense not to have it.
When it comes into metabolic cardiology and using the Equiscope, I'm all in.
A device that'll scan your body, a device that'll enhance your immune system and do what God has created you to do, and that's to heal thyself.